Hello, my name is Macy Llewellyn and I'm going to go over human errors in nursing. So for the introduction for human errors within nursing, there's just many areas that go into this. So I'm just going to break down a couple of areas that go into the errors that will happen in healthcare, but specifically in nursing careers. So nurses that work in hospitals are at high risk of fatigue. This can be due to multiple factors and is different for each nurse. So within the many human factor errors, I think it really depends on the articles that I researched that said it depends on each individual. And next, the second factor is a schedule that is not a typical schedule that someone works. Nurses that work in a hospital typically work 3 shifts a week that are 12 hours each. And this depends if you're in a hospital, inpatient or outpatient setting, but typically this is the schedule that they work, which also plays a big factor in human errors and fatigue, and I will talk about that a little bit more farther on. So the first factor is a stressful work environment that can include a heavy workload. So this is very large when we're talking about patient ratio and the workload that they have, if it's like ER or ICU or inpatient rooming, and so this can also play a big factor into the human errors. There are many people that experience fatigue that work in a hospital, and this is a human error that is occurring on a daily basis. So stress, let's talk about stress. There is a consistency within the healthcare system with stress and high workload. This is a result to burnout, and that also can be a result of mental health problems, performance, patient safety, and overall fatigue. And that is what the nurse may feel on each shift. This plays a large factor in the nursing profession as well as overall patient health. There is ongoing research for the nursing profession and what would help with overall stress for the nursing field and the overall patient health that are affected. So there could be things that would help within the nursing field that might reduce fatigue and stress and the workload, which could be a good nursing patient nursing staff. So there could be a lot of nurses per patient, so there will be a less patient workload for the nurses, and just maybe little breaks, longer lunch breaks, just more time to chart throughout the day. So more employment for nurses would be an overall solution to reducing the stress. Okay, medication errors. So this is one of the human errors that will happen in healthcare. Let's talk about that. So medication errors is a result of over 250 deaths per year, which is the nationwide third leading cause of death, which was reported in 2017. This is a result of the demand that is placed on nurses, which includes workload stress, fatigue, and the shortage of nurses. Each hospital has a nurse-to-patient ratio, just like I was talking about a little bit earlier, and depending on if you're in the ER or ICU part of the hospital, the patient ratio will be different based on the need of patient care. When there is a low staffing number, these numbers can change, which can result in the medication errors, which can be fatal. And for the conclusion of this human error in nursing, human errors in nursing result in many factors. Fatigue is a human error that is a result in what nurses face in healthcare, and this can be every day. There are many human errors that happen and result in many factors, and healthcare has many human errors that can occur. Just like any healthcare profession, fatigue is a large concern across the board and can determine positive or negative outcomes. And just wrapping up with the conclusion that there can be a solution, and within human errors, psychologists are trying to figure out really what would reduce the fatigue, the human errors, the stress, the overall workload, and this is a human error factor. And yes, you can, have more employees, like I said earlier, but within healthcare, there can always be a human error happening, no matter if the patient ratio is good. There could be medication error happening with lack of fatigue or just result in fatigue. And so there's many human errors that can occur even if you try to eliminate all things possible. So I just wanted to mention that as well for result of human errors in nursing. And here's my citations, and thank you so much for listening.